COVID-19 has changed daily life in San Diego, shutting down restaurant dining, closing theaters, and limiting capacity in stores. But San Diego jails remain near full, despite several outbreaks at facilities across the county.
The failure to reduce the populations in these jail facilities is really coming home to roost. We've seen numbers spike and balloon in the last 14 days in ways we have not seen in the 9 months previous.
That spike of cases has prompted the ACLU of San Diego and Imperial counties to file a public records request, trying to find out how the Sheriff's Department has handled the COVID-19 pandemic and what measures are being taken to stop the spread. As of Monday, according to the Sheriff's Department, there were 396 active coronavirus cases among inmates and 119 active cases among staff. With just under 4,000 people currently incarcerated in San Diego's 7 jails, that 10% positivity rate, not of those tested, but of the total jail population, points towards a looming disaster, especially with local ICU capacity already hovering near 0%.
And the idea that we are just placing these powder kegs throughout the county that might go off at any minute and overload those systems. That's where we talk about it being dangerous, not only for the people on the inside, which should be enough, but dangerous for the health workers who are working, who are already overtaxed, and dangerous for the community at large, who might need who are going to need those beds as well.
According to statistics obtained by the ACLU, the jail population in San Diego has increased at almost every facility, even as the pandemic has become more severe, and after the state lowered bail amounts for almost all nonviolent offenses to 0. In a statement, the Sheriff's Department told KPBS that it always complies with public records requests, like the one from the ACLU, in the required statutory timeframe, and that since the start of the pandemic, the San Diego County Sheriff's Department has been transparent about the strategies it's put in place to mitigate the spread of COVID-19 in its detention facilities. Those strategies include social distancing and mask wearing that have kept COVID numbers low until recently, when the rest of the county has also seen a surge. But for inmates at county jails, if they're one of the hundreds who have gotten sick in recent weeks while in custody, there might not be any care available for them outside of jail, setting up a potentially catastrophic situation. Max Rivlin-Nadler, KPBS News.